People defend this. They defend this system. How brain dead can you be? I don't get it. I don't get it. Someone help me. Someone help me understand. This is irrationality. You have the freedom to sign up for a plan with unknown prices. The only thing that works is Medicare for all.
Let's mold in the Central Committee. Let's cringe in the Central Committee. Let's bog in the Central Committee right now.
This is American healthcare. Pepe La NA healthcare. Pepe La NA healthcare. I guess I shouldn't say NA because Canada has single payer. The price for a colonoscopy at Beaumont Hospital Royal Oak is $728 with a Blue Cross plan, $999 with a Cigna plan, or $1,801 with a Humana plan. Hospitals insurers don't want you to see these prices. Here's why. This year, the federal government ordered hospitals to begin publishing a prize secret, a complete list of the prices they negotiate with private insurers. An Insurers Trade Association had called the rule unconstitutional and said it would undermine competitive negotiations. 4 hospital associations jointly sued the government to block it and appealed when they lost. They lost again. And 7 months later, many hospitals are simply ignoring the requirement and posting nothing. The data from the hospitals that have complied hints at why powerful industries wanted this information to remain hidden. It shows hospitals are charging patients wildly different amounts for the same basic services. Procedures as simple as an x-ray or a pregnancy test. And it provides numerous examples of major health insurers, some of the world's largest companies with billions in annual profits, negotiating surprisingly unfavorable rates for their customers. In many cases, insured patients are getting prices that are higher than they would if they pretended to have no coverage at all. Cigna is an insurance company. These are health insurance companies. Amazing. Until now, customers had no way to know before they got the bill what prices they and their insurers would be paying. Some insurance companies have refused to provide the information when asked by patients and employers that hired the companies to provide coverage. The secrecy has allowed hospitals to tell patients they are getting steep discounts while still charging them many times what a public program like Medicare is willing to pay. And it has left insurers with little incentive to negotiate well. Customers judge insurance plans based on whether their preferred doctors and hospitals are covered, making it hard for an insurer to walk away from a bad deal. The insurer also may not have a strong motivation to, given that more that is spent on care, the more an insurance company can earn. Federal regulations limit insurers' profits to a percentage of the amount they spend on care, and in some plans involving large employers, insurers are not even using their own money. The employers pay the medical bills and give insurers a cut of the cost in exchange for administering the plan. More Americans than ever are enrolled in high deductible plans that leave them responsible for thousands of dollars in costs before their coverage kicks in. Patients often struggle to afford these bills. 16% of insured families currently have medical debt with a median amount of $2,000. Even when workers reach their deductible, they may have to pay a percentage of the cost. In the long run, the high prices trickle down in the form of higher premiums, which across the nation are rising every year. At the hospital of the University of Pennsylvania, a pregnancy costs $18 for Blue Cross patients, $58 for Blue Cross HMO patients, $93 for Blue Cross PPO patients, and $10 for no insurance at all. Wow. What the fuck? People are carefully weighing two plans, choosing a higher monthly cost or larger deductible, have no idea that they also may be picking a much worse price when they later need care. Even for simple procedures, the difference could be thousands of dollars, enough to erase any potential savings. The ACA doesn't work. The only thing that works is Medicare for all. Everything else is fucking stupid. This is the same procedure at the same hospital, and depending on whether you have an HMO or PPO, it's $1,000 or $4,000. And it's not if employers can share that information at open enrollment. They generally don't know either. It's not just individual patients who are in the dark. says Martin Gaynor, a Carnegie Mellon economist who studies health pricing. Employers are in the dark. Governments are in the dark. It's just astonishing how deeply ignorant we are about these prices. People defend this. They defend this system. How brain dead can you be? I don't get it. I don't get it. Someone help me. Someone help me understand. This is irrationality. You have the freedom to sign up for a plan with unknown prices. Take the problem Caroline Eckelberger faced after a stray dog bit her son Nathan at a Utah campsite last July. Nathan's pediatrician examined the wound and found it wasn't serious, but within a week, Nathan needed a shot to prevent rabies that was only available in emergency rooms. Mr. Eckelberger brought Nathan to Layton Hospital in Layton, Utah, near her house. It hadn't published price data for an emergency rabies vaccine, but the largest hospital in the same health system, Intermountain Medical Center, has. Nathan, then 7 years old, received a child's dose of 2 drugs to prevent rabies. The bill also included 2 drug administration fees and a charge for using the emergency room. Intermountain owns a regional insurer called Select Health. It is currently paying the lowest price for these services, $1,284. In the same emergency room, Region's Blue Cross Blue Shield pays $3,457. Mr. Eckelberger's insurer, Cigna, pays the most, $4,198. For patients who pay cash, the charge is $3,704. Half of the insurance at Intermountain are paying higher rates than the cash price. Oh my God, look at this. This is what? Absolute insanity. Just totally insane. Prices were still secret when Brian Doherty went to an emergency room near Orlando, Florida for a rabies shot after a cat bite last summer. I tried to get pricing information, but they made it seem like it was such a rare thing they couldn't figure it out for me, he said. He went to Advent Health in Orlando because it was close to his house. That was an expensive decision. It has the highest price for rabies shots among 24 hospitals that included the service in their newly released data sets. The price there for an adult dose of the drug that prevents rabies ranges from $16,953 to $37,214, not including the emergency room fee that typically goes with it. Mr. Doherty's total bill was $18,357. After his insurance contribution, he owed $6,351. I was in total shock when I saw they wanted me to pay that much. Who ultimately negotiated the bill down to $1,692. This is insane. Totally insane. How? How is this real life? How is this real? Holy shit. It was the most convoluted, useless process, as Miss Eckelberger was able to get the bill waived after 5 months of negotiation with the hospital. Mr. Eckelberger received the additional bill because the new employee provided incomplete information with a price estimate that was not accurate. The new price data is often published in hard-to-use formats designed for data scientists and professional researchers. Many are larger than the full text of the Encyclopedia Britannica. The potential penalty for the federal government is minimal, with a maximum of $109,500 per year. Big hospitals make many tens of thousands of times as much as that. Jesus. The hospital had treated Miss Eckelberger's son as being posting some information, but to spread its prices across 269 web pages to look for rabies, you have to check them all. It isn't there. How is this not on every news channel, but we are worried about Afghan... Well, first of all, we should be worried about Afghan women and refugees. But this is the American system that people defend as if it's rational. Totally absurd. We do politics here every morning starting at 10 a.m. 10 a.m. Eastern, 7 a.m. Pacific. You can watch us here on Twitch. We're the morning guy. The morning politics guy. Politics Frogs in every single day. Same time, 10 a.m. Day in, day out. And we carry you through your morning and early afternoon politics needs. And if you need more, Mike from PA, we have a YouTube channel. We talked about suburbs, the My Pillow guy, Ted Cruz. We talked about DSA. Amazing. Making fun of Tim Pool. Amazing. Look at all of these amazing videos. Get in there, watch them. We have me on Twitter. You got to follow me on Twitter, chat. I'm at 20,614 subs. That means I got like 40 followers on Twitter in the last day. You can do better than that. You can do better than that. Go follow us on Twitter. And of course, join the Discord, where we have an incredible community of left-wing streamers. We have left-wing community. We talk about the stream. We talk about politics. There's gaming content. It's a really awesome, supportive place. Direct action, mutual aid, and you can just let off some steam. And also, you can help produce the show. One of the things I do is I look at the links that are put into the news content suggestions chat room on the Discord. Join the Discord, come hang out, and maybe what you want me to talk about will be part of the next show.